You want to start, Sinai?
I have a history in the medical field, so I pretty much have always known I wanted to go into nursing.
I kind of started at the bottom and now I'm here kind of thing. I river and then a med tech, CNA, and now I'm a monitor tech at Sacred Heart.
I wanted to go into nursing because when I was growing up, my Nana had multiple sclerosis and she was really sick. And so my mom and I were in and out of the hospitals with her a lot. I just noticed the nurses were like the number one people in there all the time with her. I looked into it and I thought there wasn't a better career out there than to get paid to help people.
I think when we learn topics, they always revert back to like how it applies to COVID. Like there's always something to be said about COVID and why it's important to keep in mind for the treatment of, this novel virus. I think COVID has brought upon like a ton of inconsistencies with how school is managed. I think it's hard for every quarter, but specifically first quarter students.
First quarter is like, if you've never worked in the medical field, it's the deciding factor of if you want to continue. It builds a pathway for your whole career. And if you miss out on those like crucial steps, like they're not going to find out that that's not what they want to do.
I feel like what it did delay is, like Sinai said, for those first quarter students, they didn't get a clinical. They definitely missed out on like really getting their feet wet, and they weren't set up for success for second quarter once we were back to clinicals and back on campus.
I want to work in the hospital in cardiology.
I'm between cardiology or neurology at Sacred Heart, hopefully.
And I plan on working in the NICU. I work there as a nurse tech right now. There's always a staffing shortage at the hospital, always. And COVID definitely has exacerbated that for sure, because a lot of employees will have exposures and they'll have to be out in quarantine, so that just takes staffing down.
A nurse who gets COVID, let's say she sits down at the nursing station and takes off her mask for a second, she now exposes all those other nurses at the station. They're out of work for however long it is now, 10 days. And when we've seen that both at Deaconess and Sacred Heart, where whole floors of nurses, not whole floors, but like a majority of the nursing staff has tested positive.
It's the PPE. You want to be safe. You want to keep your patients safe, and you want to keep yourself safe. So you want to make sure you're putting this PPE on correctly. You're taking the time to do that. It takes about 10 minutes?
Yeah, to put everything.
A lot of the floors I've worked at, their staffing, they don't allow a nurse to take more than 2 COVID patients at a time. A lot of floors you have a 3-to-1, so 3 patients to 1 nurse ratio. But I've also worked on floors where they have 5-to-1 ratios. And then you take into account that, you have a ton of COVID patients on that floor. So you have a good majority of your nurses who are taking on those COVID patients. So that takes them away from patients who don't have such a high acuity.
The floors are doing this thing called cluster care, where let's say a patient calls for water and then maybe the patient's also incontinent. So you would get all your incontinent, brief change supply. You get all the meds you need, and you go in there with the water and all this other stuff, and you just cluster everything. And you're like, okay, I'll see you again in 2 hours, unless there's something emergent. So you conserve PPE and minimize exposure.
I actually saw this in my clinical experience where we had a patient who spoke a different language, and we have a electronic translator where a person comes up like Zoom, but they didn't speak the correct dialect, so the patient wouldn't speak with us. It's kind of scary because we can't properly assess the patient, and they did have a family member that came in with them that can translate. So we run into all these unfortunate situations when we can't have visitors, especially end-of-life care too. We don't want patients to die alone, and unfortunately that's where we're headed. I think just be patient with students, because we're learning just as much as you are at this point, and to all our fellow nursing students to hang in there, because they're going to need us.
I'd love to encourage new nursing students as well as current nurses to just keep a positive attitude and hang in there.
In nursing school, first quarter, we learn about this person. Her name is Florence Nightingale, and she has a really good quote when we talk about it in first quarter, and it says, "How very little can be done under the spirit of fear. Were there none who were disconnected or discontented with what they have, the world would never reach anything better." And I think that's a great quote. I think it applies to everything we're experiencing: the fear among nurses, the fear among students, and the fear among patients. COVID is scary. It's super scary, especially when you're undereducated about it. I hope that people who think they have a passion for nursing remember why they have that passion. We're here to help people. As a student, I sometimes feel powerless to treat and help these people. But one day we will be nurses, like grown-up nurses. We'll be able to help all the people we want to help. Just don't let your fear deter you from your dream.